Bloomberg Audio Studios. Podcasts, radio, news. This is Bloomberg Businessweek with Carol Massar and Tim Stenovec on Bloomberg Radio.
Well, last week, the Dutch medical tech company Royal Philips lowered its profitability outlook for the year due to the cost of dealing with rising trade hurdles. The company said it estimates a net tariff impact of as much as $340 million. Jeff DiLullo is North America's CEO at Philips. It's got a market cap of around $22 billion. And even though it's based in the Netherlands and operates in about 75 countries around the world, it does get about 40% of its revenue from the U.S., which is the largest single market for Philips. Jeff joins us here in the Bloomberg Interactive Brokers studio. Jeff, good to have you with us. One of the big headlines to emerge last week from the earnings report was that Philips plans to localize more production in the U.S. in response to tariffs. What are some details you can share about that?
Well, first of all, we've been working since the pandemic, really since first Trump administration, to really start to regionalize what we do. There's in the healthcare, health tech industry specifically, they're very complex supply chains. There are a lot of things that are very unique to regions. So we have to work in terms of what you can do over time. We just recently announced the expansion of, by the way, I think it's closer to 50% of revenue now in North America. So we're pretty excited about that. We've increased expansion of our devices business up in Minnesota. We're announcing an increase in our manufacturing capacity for ultrasound, which is made in the USA. And right here in New York State, in Latham, in the west side, we make the world's best helium-free MRI magnets that go all over the world. The challenge with doing that is that these supply chains have been set up over many years with very complex ecosystems with resources that are only in certain areas. So as we continue to regionalize that, we're continuing to invest in R&D and production. I would also share that there's a lot of work we do as a regulated industry to work with the FDA, because everything we stand up has to be cleared and go through that whole process. So it's a continuous process, and we evolve as the market evolves.
All right. So what's the right balance, Jeff, when it comes to FDA oversight, regulatory, to make sure that everything you do is safe for all of us versus you're not being over-regulated? What is that balance? How do we figure out what's the right thing here?
Well, that is a tight walk. But what I would suggest is we also, as a multinational, don't just deal with the FDA. We deal with other commissions, other regulatory agencies all over the world. And so really, one of the challenges we have
is ours harder than, Europe we often hear about, or overseas that it can be even tougher.
I won't opine to what's harder. They're just very different.
Okay.
And so in the FDA, for example, everything we design and deploy, we work with the FDA to do. In that design, obviously, we need clearance to sell in the U.S., but the design, the structure with the FDA, the clearance process is very, very straightforward here for us. And so that's really a lot of our design. And
so do you know what anything to change? Because I guess we're trying to figure out what's the next phase of this White House and this administration. And I think there's some expectations that regulations are going to be eased and easier. And I do think about what that means for consumer-facing companies and businesses.
So we're a 134-year-old
You've been around
company today. We operate in 100 countries. We deal with many regulatory agencies. And so our license to operate is not just dependent, it's highly dependent on the U.S. for long-term growth, but it's not only dependent on the U.S. And so we also understand we have to evolve as evolves, but manufacturing footprints, they are long-term investments because of some of the reasons I already mentioned.
Right.
Both the sourcing and also FDA requirements. So we take the approach of we optimize our supply chain and be as agile as possible within the regionalization structures we need to have. And even the move toward regionalizing much of China has been over many years, right? It wasn't something we've been in China for 100 years and we've really been regionalizing that business. So as we see those trends.
So when you say regionalizing, moving away from China, what does that mean?
No, local for local. So we build and design locally, and as we see these trends, but practically speaking, you cannot build, no company can survive creating an entirely vertical integrated system in one country.
You said the helium-free magnets, for example, that you make in New York State. Those are in New York State and you ship them all over the world.
All over the world. And so depending on the administrations here and abroad, we may pay different levels of taxes. Typically, free trade agreements have enabled medical technology and med devices specifically to have a very low barrier because of the life-saving capability of everything we deploy to health systems all over the world.
Where are you seeing right now the biggest areas of growth when it comes to med tech?
Well, medtech, plainly, I'd say when I think about our portfolio, medtech for us is we provide a lot of goods and services, products and services across the ecosystem in healthcare. What we're seeing is a higher demand of workflow and AI-enabled capabilities that connect disparate pieces of data or information around patients, and then create orchestration to create analytics and intelligent decision support on top of that. That's
Right.
where we're growing.
That's really what I was getting at.
Yeah.
Is where is the tech that is going to make us live longer, healthier, happier lives? Where is that tech touching us?
So let me give you an example in radiology, because everybody can digest radiology. So the blue seal magnet, it's a helium-free magnet. Helium's not very good for the environment, but it's also very expensive, right? So we are the only helium-free magnet here, and we're producing them and delivering them all around the world. That's really good, but it's the software and the AI that we put on top of the magnet is a game changer. So this year, for example, in the United States, we'll do about 40 million MRI scans across the country. We'll do 40 million scans. So the AI that we have sitting on top of that platform in the room allows us to compress the scan for a much better result, much clearer image, takes the noise out, doesn't add to it. It just takes the noise out and makes a much clearer image, but I can do it in half, maybe a third of the time. So if you can imagine healthcare having backlog care delivery, long wait times, I can actually compress and have many more scans per day, better outcomes for patients. By the way, if you've ever been in an MR, it's a clunky, horrible experience.
Loud, too.
If I can make it 20 or 30 minutes instead of an hour, that's a big deal.
And you hope, could it be an off day for the person who's reading potentially the scan?
So we'll go to the next place, right? So if I can do it faster, I can get more throughput. Hospitals see more people. We get better, more accurate results. Second, I can get it into workflow for radiologists. We will lose radiologists this decade by the thousands, right? It just fewer people are entering the field than are leaving the field.
Shocking.
So to be able to
changes,
orchestrate that, to prioritize the most important case, and then apply AI today that we can actually read and say, hey, you should look at this. Here's an anomaly. We want you to look at these slices. I can save minutes of reading per day, or minutes of reading per scan or per study. If you could extrapolate that times 40 million scans just for MRIs, now you're changing the industry.
Yeah, it's pretty dramatic. We only have a few minutes left here. I am curious, Jeff, we're in a moment where uncertainty comes up a lot. Administrations come and go. There are some policies that people think are going to have a lasting impact on the U.S.'s role in this world. How do you see this time? You got to make, decisions as head of a company or a head of a division within a major company, global company. Yeah. So how do you look at this moment in time?
I'll be very succinct about this. What happens in medtech is a problem that we have to deal with as an industry. You've seen a lot of earnings announcements in the last few weeks.
Yep.
We focus on the patient. If we focus on the patient and the innovation that we're delivering is patient-centric and clinically designed to be relevant to clinicians, if we're doing that, we believe the pull will come. So administration aside, tariffs aside, focus on the patient, solve the problems that are very real to health systems, solve the problems that are very real to healthcare practitioners. And I'll tell you what, our business is booming. 3 quarters in a row of double-digit growth in North America. There is pull for what we're doing. There's pull for workflow enablement. There's pull for productivity. Those are the kind of solutions we bring, and we think the rest take care of itself.
Nothing slowed down during that month of April where there was just crazy market
I would actually say in
activities?
North America, I'd say there's a healthy demand for what we're delivering.
But to what extent is what you're doing dependent on the economy?
Well, so longer term. So let's take a longer term look at health systems. Med tech, roughly speaking, depending on the source, maybe 15% of a hospital system's spend in their supply chain, right?
15%.
15.
Yeah.
But the rest of it is on the rest of the supply chain, and over longer term, tariffs, things that raise costs will have an impact on these systems. And we know systems are already hurting. They're understaffed. They're overburdened. Medicaid, Medicare policy will have an impact.
Right.
Site neutrality policy have an impact. I can't control that. What I can do is provide real good productivity solutions, AI-enabled diagnostics that allow them to do their job more efficiently and spend more time with patients. And that's really where our focus is.
Do you have a message to people who are looking to maybe move some of their supply chains into the United States? I mean, is it more expensive by doing stuff in the U.S.?
That's highly dependent on what you're doing. I mean, this is such a diverse supply chain. It really matters on where your sourcing is, where your multi-tiers are. So my message is, if you're in healthcare delivery, focus on the patient. Focus on the problems that are very real for healthcare problems like long lead times for diagnostics, faster diagnostics, more accurate diagnostics, and better monitoring from home to hospital so we can keep people closer to where they live. If we're doing that, we believe the systems will come and support that.
All right, great stuff. Hey, listen, thank you so much. Come back soon. Love to hear how kind of the year is progressing.
Great to be with you. Thank you, guys.
All right, Jeff DiLullo, he is North America CEO at Philips, joining us right here in our Bloomberg Interactive Broker Studio. Jeff, thanks.